Okay, so it's going to be a fun 4 semesters. It really is. It's a lot of work, but it is fun. All right, it is fun. And we as faculty and student services, we are all here for you. We cannot read your minds. Okay, you'll learn about communication, nonverbal and verbal, but we cannot read your minds. So you need to figure out communication. Now, most of the time, if you have a question relevant to you, you need to maybe think about, should this be a private question with a faculty member, right? Because sometimes if it's specific to you, raising your hand, you don't have to share your life story, right? Okay? So, usually there is some anxiety, right? There is some anxiety. You don't know what you signed up for, do you? Okay? You know, this is your journey, your dream, your life that you've planned for. You put in a lot of work to get here. All right, so now you're feeling a little anxiety. So you know what? We're going to start to tell you a little bit more so you can let go of a little anxiety. So here we go. Why don't you look? Why don't you take the PowerPoint out? All right, take the PowerPoint. But let's first look at all the papers you have. So you know you have a piece of paper, the fact sheet that you do have to hand in today. All right, you do need to hand that in today. You have the PowerPoint with information, right? PowerPoint. You have a booklet, right? A booklet on both sides. And then you have a math packet, And in a little while, you're also going to have the nursing student handbook, all right? Which is almost, if you want to think about it, your contract, all right, with the nursing program. So here, look, we're in the A wing, right? That's where our classrooms are in the lab. Those of you who take sciences here know the A wing, right? If you don't, you'll learn. White shoes, we talked about white shoes, right? Okay? Look, they're all white, right? They're all white. There's no blue on them, there's no black on them, they're all white. Okay, we're going to talk about uniforms. I'll leave that for a little. But you are becoming registered nurses, all right? You are going to complete a 4-semester program in nursing. There are other co-requisites. Some of you may have completed those already. Then you will sit for the registered nursing licensure test. And then you can go out and practice as an RN, if you can. So, have to pass the 4 semesters, right? Have to pass the licensure test. Make sure all the co-recs are done. You also have to have integrity, right? Because Edie, the director of nursing, has to sign off, and all the faculty have to sign off, that we're saying you have integrity. You have professional integrity, and we can trust that you are taking care of people's lives. Now that's sometimes scary, right? That's scary in itself. But I want you to take that fear away. Just know, okay, so I have to be honest, right? That's what it's saying. I have to be honest. Am I going to learn how to be a nurse? Yes, it takes 4 semesters, right? Will I know everything in 101? No. But will I follow instructions and think about something? If I think something's wrong, will I speak up? Right? So those are things that you're going to learn. So let's go on here. And I'm putting up some names here. And Judy Albright is not with us today. So I'm going to put all course questions come to me. I'm Lily Rayfield. Okay, so Judy is not here today, won't be here for this summer, but everything's going to come to me. So you have a question, see my emails there. All right, you have a question, there it is. Sue Turner, right? Sue Turner. All right, now, there's Sue Turner's email, but what did Sue say? Who does Sue want you to call? Certified background. So look at that form. There's a phone number and email there. She wants you to call there. Now, Sue, guess what? How are we going to know on July 1st or on December 1st that you've done everything you can? Well, guess what? Sue can see what you're doing. all right? So she can check, because the reason you have to do all of this health requirements, the hospitals and long-term care and rehab will not let you come into the facilities without this being done. So that's why we have to do it. And I'll tell you a quick story. So there were 2 schools of Bacchus, all right? Somebody ended up having chicken pox on the floor, highly contagious. Our school got to stay on the unit because we could show that everybody had a varicella titer and that they were immune. The other school didn't have all those titers. So there's a reason behind what we do, all right? A reason. Okay, Jamie's email, okay? But I want you to take notes. So what do you write next to Sue's name? Put call certified background, all right? Okay. Some of you are psychomotor learners. Taking notes is important. If you like to fidget in class, you're a psychomotor learner. Many nurses are. That's why you like to do tasks, right? You like to do those things. So writing notes and taking notes helps it go into your brain. Remember how Alyssa said study every night, right? Okay. Help it 24 hours, go into your brain, write, move your hands, do that. Again, make sure you register. I can look out here, Nancy's looking out here, and we see a wonderful group of people, all right? A wonderful group of people. I don't want to have to come back and say, why is this person not here? Because they didn't fill out things by, July 1st, that's kind of... So the one thing I just want to be clear, you know how Sue stood here and said, there's a continuing education course for CPR, maybe August something? So that's not for you guys, right? Because your stuff has to be in July 1st. You guys, that might help, okay? Information sheet. You have the information sheet. Again, if there's any changes, you need to notify me. I am using your school email, all right? School email. So that's what I'm going with. Registration, these are some of the dates. You have it written down here. Again, if it says June 1st, then I want you to think a month before. So put those dates in your calendar. Get things done before. Be proactive. Let's look at the consequences. Right? Look at the consequences. You've worked so hard to get here. You've been accepted. Follow through with what you need. Here, Sue talked about this. And notice how Nancy helped prepare this PowerPoint. So notice how she highlighted in red, titers take time, do it now, right? You got to call that doc's office or the walk-in clinic, wherever you're going, because they're not going to give you an appointment right tomorrow, usually, right? So, and then you need blood work, then you need that it's the right blood work. All right. Here we are, all right. The concept of online, if you do something online, you have to go in and demonstrate your skills. So some of you, that's what you like to do. For others, you go in for 4 to 6, sometimes 8 hours, and you learn your stuff. Uniforms and student handbook. I'm going to turn it over to Nancy right now, and she's going to talk a little bit about uniforms. And everybody have a student handbook?
Okay, I passed out the student handbook. It is required reading. You will need to have that read by the beginning of class. So for you guys, that's August. For you guys, that's January, okay? Read that. It is, as Lily said, a contract. It will, between you and us, it will tell you what we expect of you and what we will expect you to do, okay? So that is required reading. That's your first homework assignment. Next is Alexander's uniforms. We are in the, for those of you who maybe know people in previous classes, you may not get your uniforms from them because we are changing our uniforms. We will be in a new uniform starting with you guys and then going to you guys. And that uniform will be royal blue pants with a white scrub top and a white warm-up jacket. The white warm-up jacket is optional. You do not have to have buy the white warm-up jacket if you do not want it. But you have to buy a white scrub top and royal blue pants. Question?
Do brands matter?
Yes. You may buy only the ones that we allow you to buy. You may not go down there and buy cargo pants, you may not go down there and buy mock wraps, you may not go down there and improvise. We have told them the styles that we permit, and that's what you will have to buy. Okay, that's a very good question.
But you do have choice of like 3 styles.
Yeah, there's 2 different styles of scrub top. There's a unisex, there's one that has 1 pocket versus 2. The pants, there's 3 different styles of pants for the ladies to choose from. Drawstrings and elastic waist, there's a unisex, there's a variety of pants. Different bodies need different pants, okay? Everybody knows that, right? And you're a little stuck. All you got is there's a unisex scrub pant, and then there's also a men's scrub pant, which is specifically for men. That's fine, we will give you that choice because we know that one size does not fit all bodies. We've been there, we've done that. So there is some choice down there, but the Alexander's uniforms, the salespeople down there know exactly what styles are permitted for Three Rivers. So you will have some choice, but you must have royal blue pants and you must have the white tops. A white scrub top, white warm-up jackets are optional. Now, they will tell the men that there is a difference. There's a men's warm-up jacket versus a ladies' warm-up jacket. They're both styled the same, but the men's is about, 2 or 3 inches longer. So if you need a little longer in the torso, that's the difference. Most students are not buying those warm-up jackets, and that's fine. You don't have to if you don't want to. But if you're cold, you cannot put on your Pittsburgh Steelers sweatshirt and wear that to clinical. Okay? You may wear a plain long-sleeve white t-shirt. I don't want to see dingy, dirty ones. I don't want to see worn-out ones with holes in them. Okay? You have to look professional. And believe me, why did I say that? Because I've seen that. If you don't look appropriate in uniform, we will tell you this is very countercultural. We live in a society where you get to wear whatever you want, but guess what? In nursing, you don't get to wear whatever you want. And we will tell you if you are not dressed appropriately. Question?
Yeah, for the lab coat, it has to be white or can it be different color?
No, white. White warm-up jacket. That's it.
All right. Part of the reason it's white too is because the literature shows that actually there's many generations that you are taking care of in the hospital right now who do not think that you are a nurse unless you're wearing white. And so that is part of their perception. That is who we are taking care of.
Once you graduate, you're gonna have your choice, a lot of choice, depends on where you work, though some of the institutions are requiring that the registered nurses have at least 1 white component in their uniform. They will let you choose that component, but they're requiring 1 white component. The literature is very interesting, and they've done research studies to see what kind of uniforms patients prefer to see in nurses. The adult patients tend to see at least 1 white component. Pediatric patients do like the brightly colored scrub tops with the big prints and patterns. Adults don't like those. Adults, for a print or pattern, will prefer a fine, more on the geometric side, print or pattern. But, so that's where we are with that. And Lily, I think, already talked to you about shoes, scrubs and shoes. Yes, shoes have to be white. They can't have logos on them. They have to be plain white. They may not be canvas. Because if you drop a scalpel, if somebody drops a scalpel or a needle, and it goes on your foot and you've got on a canvas shoe, you will be stabbed. And you will be exposed to bloodborne pathogens and injured, and we don't want that to happen. So, and this actually is not so much our reg, that's hospital regs. People are required to have on leather shoes. Now, if they're vinyl, I'm not gonna know about that, but they can't be canvas, okay? Everybody got that, so no tennis shoes kind of thing. Okay, any other questions about the uniforms? You go to Alexander's, they have the exact components. I did speak to her today. She said they will be in stock starting tomorrow, so if you want to go down now, you can. There is a patch that is sewn on the sleeve of the white top. It says Three Rivers Nursing. Patch goes on the scrub top as well as on the warm-up jacket. It can take them a week to get that sewn on, so don't wait until August 26th to get your uniform, please, because you will be in uniform on August 28th. So you need to get that done over the course of the summer. You guys have a little more time. Was there a question back here?
Yes, this Alexander's uniform, where is that located?
Oh, good question. It's right out here on Route 82. Just down the street a little bit from that awful intersection.
You know where edible arrangements is? So edible Arrangements is there, there's a Chinese restaurant in there, there's a bank in there. Okay, in between McDonald's and Burger King? Yeah, right, it is, in between McDonald's and Burger King.
Liberty Bank.
Okay, Liberty Bank.
Alexander has the warm-up top that you guys let us wear. They have it.
Do they have the
Yes.
warm-up jackets? Yes, they do.
Okay.
Do they have shoes? Now, you can buy shoes there if you want to, but you don't have to. You can buy shoes wherever you want. A lot of people are liking the dance goes, the nurses' white dance go shoes, that's fine, you can wear those. You wanna wear a plain old athletic shoe, as long as it's plain white. I wear Easy Spirit because that's what feels best on my feet. As long as they're plain white, that's fine. You got Adidas, you got Reeboks, I don't care, as long as they're plain white and they don't have the logos on them. Question, Jack.
When you say the warm-up jacket, is that the same jacket that we purchased for micro?
No. No, that's a full-length lab coat.
Okay.
So if you want to hem.
Yeah. You could, you do not have to wear the warm-up jackets if you don't want to. You don't have to buy them if you don't want to. That's entirely up to you. Did you?
Yes, no,
Go ahead.
Go.
My question is our class says that it's gonna be on Mondays, and I'm wondering, August 28th falls on a Thursday. Is
We
there
will get to
something
that.
we're
We will get to that. Oh, yes, you will have class there. And
You
you will
have
have
classes in nursing, welcome to nursing.
Yeah.
We have classes on many days that are not listed. That's what we tell you.
Yeah, but Lily's got to go over that with you. Is there another question? About uniforms, okay.
Our shoes, sorry, just the shoes, I know that a lot of them are either lace up or you can do like the ones that you slip on and have the thing in the back, is that okay?
No. You
Well, it has to
have
have closed back.
That's what, yeah, it's like the.
You cannot have open toes, you cannot have a sling back.
So it
As
has
long
to
as,
be closed.
if you have a slide-on shoe, as long as it's got a closed heel,
Okay.
and it's white.
Yeah.
If you don't remember the uniform, look on page 32, guess what, it's there. It's the only thing it says, the uniform includes designated shirts, so what did we tell you it was? White, right? Designated white jacket, program logo, designated pants, okay, so that's royal blue, all right? So it is, page 32, talks about dress code.
Another thing while we're talking dress code, so that help with the shoes? Okay, buy decent shoes for your feet, please, because you're gonna be on your feet and your legs a lot in your career. You need good shoes, that's really important. So get shoes that, you don't have, it's not a fashion statement here, folks. This is about function and this is about comfort and protecting your feet. The other thing is tattoos and body piercings. I am seeing tattoos. Tattoos are not acceptable in uniform. So those of you who have tattoos will have to have those covered up at all times. Our policy, also hospital policy, okay? If you have a tattoo here on the back of your neck, you're gonna be wearing a great big old Band-Aid over that, so that nobody can see it. If you've got tattoos on your fingers, you're gonna be wearing Band-Aids over those. If you've got them here on your arm, you're always gonna have on long sleeves. They can never be seen by patients. Body piercing. You are allowed one small plain stud in each ear. You may not go in with 5 million earrings in this ear. This, the men too. Men can wear one plain stud in their ear, but it is one plain stud. No hoops, no dangles, none of that stuff. And that's a safety. Because when you go to move a patient and they reach up like this and they loop their finger through your loop and they go like this and rip that out of your ear, you're gonna wish you had it up. So one plain stud per ear. Okay, now, I said plain stud. I didn't say something crusted in jewels, okay? Some people will wear a single diamond, maybe the measure the down enough. Don't come in with some big ball with all kinds of stuff all over it, okay? Plain stud. Tattoos covered. So if you were thinking about getting a tattoo this summer, don't. If you've got your tongue pierced, if you've got your belly button pierced, TMI, I don't need to know that. But if you've got your tongue pierced, or your nose pierced, guess what? You may not come into the clinical with those things in there. You're gonna have to take them out and not come into the clinical with those in, okay? So is everybody clear on that? You need to look professional at all times. That's part of your responsibility as a nurse. In class, you also need to look somewhat professional. We can be casual, we can be comfortable. I always tell the students, I don't want to see any cleavage, front or rear, male or female. Okay? No, people look at us, they really do. They really do. And some of nursing's image from the past has not been good. because in the 1850s, nurses were recruited from the ranks of prostitutes, drunks, and prisoners. So when the nurse goes around showing cleavage, everybody sort of reverts back to that old, very negative image. We are a profession, we care for people's in their lives, very intimate moments. We're the most trusted profession. The only time nursing was not voted the most trusted profession was immediately after 9/11, when firefighters were voted the most trusted profession. Every year since, we've been voted the most trusted profession. So we need to give a very professional appearance, even when we're on campus for class. For class days on Mondays, yes, it is true your class day is Monday. You don't have to wear your uniform. You can if you want to, but you don't have to. Usually people don't. For labs, and Lily will get into this, you will be in uniform. And even on class day, please, don't look like a bum. Don't look like you're, a streetwalker. I want you to come in here looking to be casual and comfortable, but professional, okay? Tattoos on Mondays? Okay. We can show your tattoos on Mondays, but not on Tuesdays or Thursdays or in front of them, all right? So that's that. Stethoscopes. Stethoscopes. You must buy a stethoscope too. In addition to your uniform, get a stethoscope. We'll give you a handout. Did everybody get the handout about the stethoscopes? From a company, I think it says MDI, is that what it says?
Single page, because I don't know, you have two of them, please give one back, because if you have two of them.
MDS? Okay. MDS?
Right, and so that's why somebody must have,
I printed 100. There's only 98 people in the room. I know sometimes the coffee room doesn't. I don't know. Not right. How many people are this? Are you sure? Oh, that's not right. That's not right. I'm gonna have to run and make some more copies. I'll make some more copies, folks. Are you thinking we have to buy that with it? No, no. Give me a minute. Okay.
Give it back to Nancy.
Okay, focus. This particular stethoscope is sold. It gives a bonus to the Student Nurses Association. It's actually sort of a fundraiser for them, and they will make money from this. You do not have to buy the MDS stethoscope. It is a good quality stethoscope, though, at a very fair price. But you don't have to buy this one. If you don't know what to buy and you're thinking they have a variety of colors, they have some different styles, this is up to you. But we just give you this so you know about it. If you would like to buy from them, we have found it to be a good quality stethoscope for a very fair price. You can spend $300 on a stethoscope, but I'm not asking you to do that. You don't need to spend $300 on a big fancy cardiology stethoscope. This is a very plain Littman stethoscope. It cost me about $70 if I remember right. But the important thing, whether you get it from them or if you go online and get it from Amazon, I don't care, that's all right. You can buy them in the bookstore, you can buy them at Alexander's. Where you get it is up to you. It must have a bell and a diaphragm. 2 pieces. See this part here that looks sort of scooped out? That's a bell. This part back here that's flat and has plastic on it, that's a diaphragm. Your stethoscope must have both a bell and a diaphragm. You need that to be able to assess patients appropriately. And some stethoscopes now are very sophisticated, and they have the bell and the diaphragm in a single head. So when you look at your stethoscope, or you're looking at stethoscopes, read about it. If it only looks like, oh, it doesn't have that scoopy part and that flat part, read the description. If it says combined dual head, bell and diaphragm, that's fine. You can have that. Don't get an El Cheapo for $10.95 at CVS. It's only got one head on. Number one, you're not going to be able to hear very well, and number two, it will not be satisfactory for listening to certain sounds we need to assess. Okay. Any color, we don't restrict the color in the stethoscopes. Put your name on everything, because if you set this down and walk off and your name's not on it, believe me, you will not get it back again. Somebody will put it into the general stethoscope bin. So please make sure you put your name on everything. And you will need this for lab. Oh, 9-5, I forgot to change. No, that is correct, for 9-5. That's the day we're doing vital signs, isn't it? What's the 3rd? When's Labor Day? That may be a boo-boo. The day after Labor Day is vital signs lab. You will need your stethoscope for that lab. So you guys, you're going to get it over the summer. You guys got a little more time. No tattoos or piercings, we already went into, and you guys will be in uniform on 8/28. That will be our first day to be in lab uniform. We will actually, and you need to have your lab totes by that day. They have them in the bookstore right now. Buy them as soon as you can. Don't wait, because on 8/28 you're going to be using equipment out of that in lab. And if you come to lab without your tote, we're gonna say you're unprepared for lab. And you're gonna be in trouble, and you're gonna be getting unsatisfactory evaluations already, and we don't wanna start out on that foot.
It's a lab coat.
Lab
Called
tote.
lab tote.
And the bookstore, and we'll talk about that, the bookstore actually has it, and what I'm gonna ask is if you are in the spring class, please let the fall class buy first. You don't really need to buy your tote on today, or even June 2nd. So they told me there were 48 totes in the bookstore at this point. And yes, Nancy, you need your stethoscope on the second.
Second, okay.
Second,
My error.
okay,
That's
second,
probably last year's date.
second.
So second, please, so you guys are gonna get your stethoscopes over the summer, all right? Any questions about stethoscopes?
Oh, it was about the lab coat.
Okay.
Maybe that one from Amazon,
Or what lab?
lab coat.
Coat?
Did you just say lab
Warm
coat?
up jacket. Warm up jacket.
T-O-T-E, tote. It's a tote bag, and it's got all of your lab supplies in it,
I got you.
okay?
You have to
Good
buy the
question,
one.
thank you.
Yeah, so, sorry, I'm here in lab coat now. So you have to buy the one here, because we asked the company to put in the supplies that you need for the labs for the 4 semesters while you're here, okay? So if you don't buy that, you won't have the ID equipment you need, you won't have the injections, et cetera, that you need. So you do need to buy the one here.
How much are the tote bags offhand?
$90?
$91.
91, thank you. Was there another question?
Oh, yes, you just said that the lab is on a Thursday, is that set hours yet, or no?
No,
Okay,
she's
and
gonna
we'll,
tell you.
Okay.
hold on, we'll get there.
We are gonna give you the calendar, okay? Is anybody in this side taking micro with nursing? That's a recipe, micro with nursing?
Oh, okay.
You are? You're micro now, okay. Anybody gonna take a micro in the fall? It's a recipe for failure, I'm sorry, it is. People who do that with nursing tend to fail. I strongly encourage you to try to take it this summer if you possibly can.
Or request.
It's just too much. We are gonna consume your life for at least 40 hours a week, probably more. You guys, same thing, okay? Anybody over here planning to take nursing, micro with nursing? Now you're all afraid to admit it.
Taking micro in the fall.
Okay, that's fine, take it in the fall, perfect, perfect, perfect. Don't try to take it with nursing, it is a recipe for failure. Many students have tried, many students have failed. Sometimes students pass. They scrape by with a C, minimum C to pass nursing, and they're used to getting A's. Okay, so, yes, you did work very hard to get here, there's no doubt about that. Guess what? You're gonna work harder to get out of here. Working hard to get in here was nothing, nothing. Working to get out of here is gonna be harder than you could ever imagine. Sorry, you willing to come off my soapbox? I'm gonna go talk to those things, I'll bring them back, okay? I say so. Okay, I'll be right back.
All right, great, thank you. So again, key elements here are all listed here. So in uniform, right? And we'll go over dates, but in uniform on the 28th, that is a Thursday. All right, that is a Thursday. And cross out, need stethoscope for lab 9-5, make it 9-2, 9-2. Nails, that's true, is nails not? So nails, uniform, read and wedding bands, okay? So if you have the major diamond of the year, notice that I don't wear any rings here, okay? And when I work, I don't. Because you can bang them, knock them, and you'll lose what you have. If you need a simple wedding band, fine, wear a simple wedding band, but, you know, think about this, you don't wanna lose something, and also infection control, it's really hard to wash your hands and make sure you get all that, the germs off your rings, okay? Nails, you know, boring nails. So enjoy for women or men. If you like nails during the summer, enjoy them all you want. But once you come to school, you have to get rid of all acrylics, okay? And basically, it's better to wear no nail polish, but you can wear a clear one if you do that each day, because you can't have cracks in it which can harbor bacteria, right? Now, I will tell you, there are certain units we go into the hospital which are going to tell us, no, you can't have that. And the reason acrylics kill babies in newborn nurseries, okay? So we know that. And I know you are going to see nurses out there that have hoopy earrings, okay? Nails that are red and long, all right? It's not what we do, all right? And I don't want you to judge them. I'm for respect for all. They're doing a hard job, but they're in their place. You're at Three Rivers. We have contracts with clinical facilities which kind of mandate what we do. So thank you for bringing that up. Okay. So, nursing student handbook, Nancy gave that out to you. Now, the handbook that you have does say 2013 to 2014. So I will, when the official 2014 to 2015 comes out, I will attach it as an email to your student email, okay? There probably will not be that many changes, so you can get a good jump start with reading this. When you come into the start of the first day of class, we're going to ask you to sign a form which says you have read it, okay, and you hand that in. This is your contract, right? So there's all kinds of stuff in there about clinical absences. Really, when you're in nursing, guess what? Every day is class day, okay? Really. If you have pneumonia, obviously you're sick, but it's very hard for us to make up clinical, okay? So it may entail that you end up with an incomplete, or you end up that we can't even give you a grade. So really, when you're planning, sometimes people think, okay, well, I need to plan that, it's my 25th wedding anniversary, and so in October I'm going on a cruise, and I'm going to miss these days. You can't do it. All right, you can't do it. Because, what if you get sick on one day? How are we going to do that? We can't make it up. Okay, so you need to think about that. You need to think about planning for, all of us may have somebody in our life, our parents, our children, our pet, somebody we take care of, who is going to be there for them when they are sick and you have to go to clinical. So you need to figure that out. So all of that is listed in here. And again, you have dates there. Blackboard, how many people in this room are from Three Rivers? Okay, so how many people have ever seen a Blackboard course? How many people have never seen a Blackboard course? So what's going to happen is 2 weeks before school starts, generally, might be a week, Blackboard opens up. And all of your course material is going to be there. I do not want you to print out every single thing. Why? Because we're going to give you books, all right? We're going to give you books in 101 where we printed out all the PowerPoints for you. We printed out the syllabus, so we're going to give that to you on the first day of class. But if you want to look at it and you want the electronic version, then feel free, download it. Okay? Feel free, so you can see that. But please do not print out everything. Again, college email. All right? So anybody who's new to Three Rivers, just make sure you touch base with me at the end. Textbooks, yes. Okay. So textbooks, actually, when you come into nursing in the first semester of nursing, they're expensive. All right? It's an expensive purchase. Anywhere potentially from $400 to $700, $800 if you buy every single book. And you have to include the tote, and that's an addition, and you're thinking of uniform and the stethoscope. It's expensive. All right? It is. All of these books you will use throughout the program, all right? So when you go into 102, you're only buying 3 books. When you go into 201, you are only buying 1 book. When you go into 203, you're only buying 2 books, okay? Because you're using all the books that you bought. It is true, some of you could rent them. You could buy them electronically too. There's an electronic version, and that's what you prefer. The only thing about electronic versions is you cannot take them generally into clinical. All all right? So if you want to book in clinical, then right now, needs to be the hard copy for the most part. You have a list of books, all right? So let's take the list of books that you have, and I can kind of guide you because you might think, all right, so what should I do? So start with the side that says required textbooks, all right? And see how it says near the beginning of the course? So that's the bundle. And the bundle is not in the bookstore right now. The bundle will be there. Most of the things they say will be there on June 2nd. All right, so by June 2nd. So again, you know, those of you sitting for the spring class, I mean, let them get a chance to buy first. They will constantly replenish the book. So, because there is jump start reading. So you have a med-surg book, a fundamentals book, a virtual clinical, a skills book, pharmacology book, and a psych book. And we use all of those books, all right? And SimChart. All right, this year, if you know people in the program and they said, well, we didn't have to pay for SimChart. SimChart is included in the bundle, but it is something that now we have to purchase, you have to purchase because, right, you're gonna get the money back for certified background. All right, so you have to pay for certified background, but you will get a credit to your account as long as you start the program. Okay. And notice there are ISBN numbers there, so if you want to go shopping around, you can go shopping around. I will tell you probably the bundle is the best price you can get, but go shopping around, all right? Go shopping around. There might be, you know, a version out there that somebody's used already. I would say buy whatever the edition is. You know, an older edition may have older information in it, and so then when you go to take the test, you might not have the most current information that is being tested. So that's something to know. You look down, now see, I want you to put a big star by Picard. A big star by Picard. Because if the only book you can buy is one book, then you should buy the math book. You should buy the math book. You do not need the online version. So if somebody wants to sell you the online version, you don't need to buy that. But you do need the math book because guess what? Then there's another packet you have here to jumpstart your math. Because we're not going to teach you math. That's why you have to take 137. But there's kind of a guided way for you to do that. And also you can use the tutoring center. And I did include a sample test so you can actually see. And you'll be surprised you can do it. But does it take practice? Yes, it does. Okay? So that's one book. Lenny, you can wait with if you're not going to buy the bundle. So let's say you're going to go shopping, all right? You're going to go shopping, ISBN numbers. You definitely need the fundamentals book, right, first. So let's say you're going shopping and you're trying to budget. So you need Potter and Perry. You need Potter and Perry. You need the skills book. You need the skills book. And you need Picard. If you can get Barcarolas, good to do too. So those are the 4 to get. You can get away with not having the med-surg book right away. You can get away with not having the farm book right away. But again, the bundle's probably cheaper. You turn it over, all right? You turn it over. And see, there's the Pearson Nursing Drug Guide, all right? So there's the Nursing Drug Guide. You can get away with that till a little later. Ackley, you'll need somewhat in the beginning. Before you go into clinical, see where it says needed for beginning of clinical, that you'll definitely need. And then all the others that are listed there are optional books, all right, are optional books. So, but what would I do? I would put a star by Summers. I would put a star by Summers. When you go into clinical, that's the best book in the world to have, all right? It actually guides you. Nugent and Vitale, there might actually be a 2013, I think there's a 2013 Nugent and Vitale great test-taking book, all right? But if you have an older version of it, it'll work too. And then look at the other thing that's actually, most students say is very valuable is the nurse's med deck. The nurse's med deck, so those are actual drug cards. So you have a pharmacology text, you do have a drug guide. You can probably get away with, you definitely need to buy learning, because you're gonna have pharmacology courses too that you need learning. But if you're trying to decide what do I do for money, and you're deciding do I buy drug cards or the nurse's drug guide, well, you can buy either one. Okay, you can buy either one. Then other books to consider, there they are. Would I buy them? No, I'd go find them in the library. If you have a dictionary at this point, great. If not, you can look for what you can find online, okay? But if you can afford a dictionary like Tapers or Mosby, it is worth, because there's gonna be words you don't know. So, anybody have any questions about the book list? So when I called, and I know it's like always like, oh, I can't believe it's gonna cost me so much to start the semester. But again, know that this is costs that you're going to have not every semester, all right? Not every semester. Okay, so I told you books that make sense if you can't afford everything. You can see here you do need the lab coat by that Thursday. iClicker is also something, and all of these you can sell back after the nursing program. iClicker is out there, it's an interactive type of thing. We'll ask you questions in class, and then you just click in and you answer. Okay, so that's something that you have. And of course, there is summer reading, okay? Summer reading. And we'll go over, there's a slide coming up with some of the chapters that we can talk about. But all students look at us. You have questions?
Yeah, about the iClicker, I don't have the exact one that is on the book list, but I have an iClicker that has the barcode and everything. Can I use that, or do I have to buy the one?
Yes, you can. You can use that as, you can't use, there's a Turner company, but as long as it's an iClicker.
It's an iClicker, but I think it's iClicker 2.
Okay, it should work. All right, it should work. You don't have to. Summer reading, we'll talk about in a minute. There are chapters to read, there's math to do, and students do report that it gives you a jump start. Okay. Here's the nursing plan of study. So I'll send that out as an attachment too, to make sure you're thinking about, have I taken all the CORACs? What else can I do? But when you're taking nursing, it helps to focus on nursing. I know somebody asked, I need to be full-time. So many students, what they do is we're an 8-credit course, and they take the 1-credit yoga course. All right, the 1-credit yoga course, it makes you 9 credits. You take it in the front half of the semester, right, because it's not a full semester, so it actually doesn't interfere with clinical. That gives you 9 credits, because what do they give financial aid for? 3-credit improvements, okay? So if you find a 1 credit, that's the first half of the semester, you know your lab schedule already, or I'll remind you of that, and that's what you can do. So look for your in your emails to just remind you about the plan of study. But the one thing I will say about the plan of study, if it says it is a CORAC, all right? If it says it's a CORAC, that means it has to be done before or with that nursing course. Not like, can I take A&P2 in the summer? No, it has to be now, it has to be done. Can I take, okay, sorry, what?
English 102.
English 102 with 201 before
You have to take it,
201.
it has to be before 201 or with 201. You can't wait till the summer after 201.
Right, it has to be before or after. Lifespan, those of you that don't have lifespan, so when you get to 102, you have to have taken lifespan, or you have to take it with nursing. So that's the only thing to really understand about the plan of study.
These co-requisite courses, we had one person in our course this spring, in Nursing 101, who was also taking English 102 with Nursing 101. and found that to be a nightmare because of the amount of reading and writing required in English 102. So if you haven't taken it yet, you thought, oh, I'm good with English, I'll take it with nursing. You better think twice about that. It will consume your life. You will. I know everybody heard me say it. Nobody appreciates it now, but in a short period of time, you'll say, oh my stars. Yeah. Is Philidor's family here? A couple people from the Philidor family here? What did Farah tell you about our course? Did we consume her life? Yes, we did. So, I mean, everybody hears it, but until you experience it, you have no idea what you're getting into. We did have one course, so remember the girl that added up, about week 2, she added up how many pages of reading we had assigned already? And she said it was 400, and we said, that's nothing. That's just the tip of the iceberg. It's a lot of reading, it's a lot of studying, it's a lot of practicing skills, it's a lot of doing clinical preparation and paperwork. So that's why I say we will consume your life. You're looking at, 2 days of clinical and 1 day of class, no big deal, but guess what? That too is the tip of an iceberg. There's so much more time, study time, lab time that you're gonna need. So please, we encourage you, if you haven't done those co-recs yet, we've got summer coming up, please get them done.
Right, take them in the summer. If you need a break this summer because you've been working hard, take a break. But take, especially you guys, you have 2 summers, right? Okay? So you can take things in the summer. But again, remember it has to, if it's a co-rec, before, right? Before or during that time. You also have the winter breaks too, all right? But you are gonna want a break, all right? You are gonna want a break, all right? So, look for that, make sure you're checking, meet with your advisors when you get your advisors, if they're not assigned to you already, to just go over your plan of study. So, I'll remind you at some point in the beginning of the fall or the beginning of the spring, or you could do it already in the fall, just sit and make sure with your advisor. Because there are other courses we would recommend for the future if you think you're going on for BSN, right? So we can tell you some of those courses too. All right, so here, start of class. All right, start of class, attendance at all sessions, mandatory. Now, I want you to look at these dates. Don't look at the school calendar now, look at this slide, okay? So, on 8/22, that is a Friday, all right? That is a Friday. The school calendar will tell you we're not even in session yet, but we are in session. So, 8/22 from 9 to 2, we are here for a technology orientation, and we go over all the computer programs that we use, all right, all those computers.
Is that fall and spring?
No, this is for fall. Thank you, Nicole, for asking. This is, we will tell you the date, all right, when we get closer to the spring. So this is for the fall. Classes begin for the fall on 8/26, right? So you will be here on Tuesday, 8/26, from 8 to 3. All right, 8 to 3. We're not sure what room we'll be in. If you see MPR, that's multi-purpose rooms, but again, you'll see an email as to where we are. There is no class on Wednesday, August 27th, for nursing. Those of you in micro, there will be a class, okay? Thursday on 8/28, we're in lab from 8 to 3, and that's when you're coming in uniform, all right, in uniform. With your toque. No, actually, we could.
Yeah, 8/28 is,
Hand washing,
PPE hand
PPE,
washing.
yep, with your toque, okay? And then notice, look Friday. We normally do not have class on Friday, but in order to be done and not be here till New Year's, okay, we have class on Friday, so that we can get in clinical. So that's when, that will also be a clinical day, all right, from 8 to 3. And so again, you can save all these dates, you know this ahead of time, and this is for the fall. Don't worry, you guys will get emails to know somewhere in November, December, so you can plan to.
That Friday, is that a lab?
That's a clinical lab. All right, so course calendar, these are other dates. Now, Columbus Day, we do have classes. I know some of you have to go for micro, so, but make sure you look at the dates, all right? Make sure you look at the dates for the A and B test, sorry. Columbus Day, look at what we've done. We've put the class from 7:30 to 10:30 so that you don't have to be here for the 1 to 3 class. So we're trying to work with you for Columbus Day, but we also have to work with micro. So students who are in micro, guess what? They go to class at 11. So that's why we're working with you. They need a little break before they go to class. So 7:30 to 10:30 is class on Columbus Day. Veterans Day, that's a Tuesday, but clinical is in session. All right, so if you end up with a Tuesday, Wednesday clinical, you are in clinical. Thanksgiving Day and Thanksgiving Friday, there is no class. All right. So that's like your 4-day weekend. All right. So you look forward to that. That's how you survive nursing school. It's fun, you love it, and you look forward to breaks. You study every day. Okay. All right. So spring, there's that whole week you can look forward to. All right, so here's spring, all right? So anticipated January 21st, that's an anticipation, technology orientation, 8 to 12, and we'll tell you about the room. All right, January 22nd, 8 to 3, that would be a whole day event. Good luck on AMP, those of you going. Okay, so the first half of the semester, the sheet.
Did you fill out your fact sheet and turn it in?
Yeah, I do.
So, it's normal anxiety before the test, then you're getting nursing orientation. Okay, so course schedule. So class is every Monday, all right, and this is the same deal for spring too, you can think about that. Class is every Monday from 8:30 to 10:30 and 1 to 3. Why are we those times? Because if you have micro, guess what you're doing in the middle of that? Okay, you're doing micro, all right? So, but these are times you can go in, you can practice in the lab, you can have study groups, you can do all that, use your time wisely. On Tuesday and Thursday, in the first half of the semester, we are on campus from 8 to 3. All right, on campus from 8 to 3. And then in the second half of the semester, and you won't have your clinical assignment until perhaps the start of the semester. All right, the start of the semester. And that being said, because sometimes there are changes as to where we're going in clinical. So towards that first week, that's when you get your clinical assignment.
Actually, Willie, you're gonna have to know their clinical assignments before.
For Bacchus.
For Bacchus and L&M too. Bacchus and L&M will require all students going there to attend an orientation session. It's
On the
L&M one is
26th, it's not till the 26th.
Oh, good.
It's
That's
not
the
till the
L&M,
27th.
4 to 6 p.m. I'm not sure when the Bacchus one is yet.
Bacchus is still to be determined, but it's not till the start of the semester. It's not gonna be before, we talked about it this afternoon.
Oh, okay.
Okay.
Because last semester it was.
Right, no.
Okay.
All right, so it may not be till the start of the course that you know your clinical assignment. For those of you that are going to need special orientations to some facilities where you're going, you will know that.
Do you have, as far as clinicals are concerned, is there a general time frame? Like, I see that it says like, Tuesday or Wednesday or Thursday evening. Do you have like the times that students are in, is it a specific time frame?
Yes, it
During
is.
those times?
Okay, so think of it, if you're the day shift, think of it that you're in clinical from 6:45 till 3:30,
Okay,
okay?
and then evening?
And evening potentially is 2 to 11,
Okay, thank you.
okay?
Okay, thank you.
You're welcome. If you are in micro, it is a guarantee that you have to be on a Thursday, Friday clinical, all right? And it could be a day or it could be an evening. Also, just to understand, if we have clinical groups, it is possible that you will not get a first choice. All right, you try to match you geographically, so you don't have to drive as far, but it is possible, you may have put days, but we may have to put some people in evening. We can't have, what if all of you say you want to go to evenings, right? We do have to have some people in days. So, you know, it is possible. That's why we ask you for the choices. So you know the days already that are different than the Monday, Tuesday, Thursday on the first half of the semester. You know some of the holidays that are on the school calendar that we are actually in class. And for Columbus Day, micro is in class in session 2. So you need to be here. We talked about finding support systems. Edie did. We're all, you know, figuring out your family plans. This is something that gives you a jump start to figure this out. When you figure this out, actually it's all doable. It is doable, but it's that, you know, be honest with your families at the start. Talk about paper plates possibly, right? You know, that type of stuff that you'll need help in cooking. That, you know, there are those type of things because by being honest with them, then people are usually supportive to you, right? And want you to succeed, and you say, after the final, I'm all yours until January something, right? Okay? You know, during the summer, I can be all yours till, okay, so, you know, you kind of, you work your deal, right? Okay, reading, so remember we talked about books that are important, Potter and Perry, there's all chapters that you can jumpstart your reading. Lewis, the Med Surge, there is some material there. Notice Potter and Perry, the clinical skills book, and Barcarola. So those are areas that you can jumpstart your reading. Students tell us they were really, really happy they did that. Really happy they did that. All right? You know, write in your books, do whatever you need to do, but this way you can do it in a more realistic pace if you jumpstart yourself. Summer math. See the handout? Right? See the handout? So you have a handout. Remember the Picard book? That's the book to use. It tells you what's the test going to be. It tells you how to use the Picard book. So you don't have to do anything, that's true. You don't have to do anything in the summer, but it does tell you if you want to work this out by week 6, you are taking the medication administration test. So why not actually go through the book so you're already there, all right? You're already ready to take it. And it tells you the chapters, it tells you what you will be tested on. So it's drug calculations, IV calculations, conversions, and keep turning the page. Don't have math anxiety panic. Okay? Turn the page, and what you see is you're going to be tested on math in every semester, except in the 4th, but it's still on your test. So in every semester. So that you just have to worry about 101 now, but remember, every semester there's a math test in nursing. Now, the important thing about math is that you get 3 times to achieve a 90. All right? 3 times to achieve a 90. If you don't achieve the 90 on the first time, we're going to send you to do some other work, to work with Sue, to work with us, because we want you to get a 90. Okay? If, however, on the 3rd time, you do not achieve a 90, then you cannot continue in the program. So that is one of the things that is a requirement. It explains it in the handbook, but it also explains it on one of the handouts here too. The handout on the bottom that says dosage calculation competency. Nurses need to be safe and competent in their care. Now, when you take the math test, guess what? You can use a calculator. We give you a calculator, okay? You can use a calculator. Guess what? We even give you you a conversion sheet. If you turn the page, right, you have the conversion sheet. So do we really want you to succeed? Yes, we really do. But do you have to do the work in order to succeed? Yes. Okay, so there it is. There are plenty of tests to take in the Picard book. I did give you one sample test here with answers. Do the pages in Picard, and guess what? You can succeed. All right, so take away fear, take away panic, but do the work. All right, do the work. So again, if anybody has any specific questions, they can always email me. Here's a book. Nancy has put this here. It kind of gives you, somewhat of what we said. So if you can find this in the library, I know the costs are heavy and stuff like that. I think it is there, and check it out. For some of you, you might find actually another edition that you can get for inexpensive, but again, nice to read. Summer. So what are you doing this summer? Again, micro, you've heard the story 5 times about micro, right? Okay, so that's your decision to make. Summer communication, use your school email. I'll probably send out something at least once a month. So I don't want you to check 5 times a day, but if you check generally, once a week, that should be sufficient, all right? That should be sufficient. Remember your health and CPR deadlines, and remember certified background is sending you emails, whatever you put in all the time. That you need to check. That you need to make sure that you're complete. And with all of that, we wish you a nice summer. We look forward to getting